I'm Dr. Adam Keefer. I'm with Coastal Vascular and Vein, and today we'll be discussing peripheral arterial disease. So peripheral arterial disease is a blockage in the arteries in the legs. And most of the time, it does not necessarily have to be treated with a surgery or procedure. What a lot of people first notice is that they develop pain when walking. So initially, they're able to walk pretty normally. But as they get older and have different risk factors, they can start to develop pain when they walk. That pain can be in the calves or in the hips or in the lower legs after walking a specific set distance. The good news is that Coastal Vascular and Vein, we're able to take the patient's history and physical and then also test for peripheral vascular disease through a series of tests, all non-invasive. The first test that we usually check is something called an ABI, and that's an ankle brachial index. That tells me on a quantitative level how much blood is going to the foot and the lower leg. Sometimes we also obtain an ultrasound of the leg, looking at the arteries themselves and specifically where the blockages can tend to be. So when you do have peripheral vascular disease, it's a very treatable condition, oftentimes without any type of surgery, and it can also be very informative for you to know going forward so you can prevent the worsening of that disease process. At Coastal Vascular and Vein, we commonly treat peripheral arterial disease. Many times when patients come in, we start them off on an exercise program. Patients who are having pain with walking, we try to tell them to exercise more, push through the pain, and that allows for new blood vessels to form and the patient's exercise tolerance to improve. We also counsel the patient on things such as smoking cessation, good diabetic control, and good blood pressure control. Quitting smoking is the single most important thing a patient can do to help their peripheral vascular disease. Oftentimes, most patients with those simple lifestyle modifications and an exercise program never go on to need any type of procedure or surgery. Certain patients, however, do progress to need some type of procedure. We are also able to do that at Coastal Vascular and Vein. We have an outpatient center where we perform something called an angiogram or dye test. We are able to look at the blood flow in the legs and oftentimes treat that with a balloon or a stent to improve the blood supply to the legs to allow the patient more functionality. For more information or to schedule a consult, please call Coastal Vascular and Vein to discuss your treatment options.